When we're doing a cervical disc replacement, I mentioned that we come in from the front. So some of the risks that are related to the surgery are approach-related risks, meaning that we have to move other structures out of the way just to get access to the spine. The trachea, the tube that we breathe through, the esophagus, the tube that we swallow through, those are moved out of the way, and thereby, because of that, there is a slight risk that those could be injured. Some of this can lead to hoarseness. Everybody after one of these surgical procedures is going to have a little swallowing difficulty because we move things over and because you have a tube down your throat when you're intubated. Now, once we get to the spine, there is a slight risk of injury to the spinal cord. It's not a high risk potential. We're working in front of the spinal cord doing this with lots of magnification, excellent lighting, and a lot of feedback from neural monitoring, which will help to give us an extra safety net to do your surgery. But all of the structures that we're working around are in the field of play, and therefore there's a slight risk of injury. I think that for most patients, the biggest things I like to indicate to them when I do my teaching with them is that they should expect some swallowing difficulty. And again, this is because of the approach. Because sometimes it's scary if you wake up and you feel like you're not swallowing as well as you should. That usually gets better pretty quickly. And the other thing that happens is when the space is really collapsed and we open the space up, we stretch a lot of the structures that are the soft tissue structures, including the very innervated joint capsules in the back of the neck. A lot of people get neck pain and spasm, which can be a little scary if you're not expecting it. But for the most part, the risk potential for this is very low, and it's a really gratifying operation for the patient and the surgeon.